Hi, this is Lyndon here again from Yummy Tummies, in day 2 of a 3-part series on how to get your body back after having a baby. Well, yesterday we talked about stress loading in the body, how it affects your body, how we need to try and calm everything down a little bit so we can put the body in a bit more of a healing process. Today I want to talk about more the exercises you should be focusing on, and also the ones which you should be avoiding, and the ones which you do good and ones which are potentially harmful for your body. The first thing we need to do is look at some basic anatomy. So in terms of your abdominals, okay, you've got your six-pack muscle down the front, your rectus abdominis. That's the one that actually separates throughout your pregnancy to allow the baby to grow, and they expand, etc., and they come back and close the separation post birth. You've also got the obliques on the side, external obliques on the outside, internal obliques on the inside, and you've also got what's called the transversus abdominis. This is the one that most people refer to as the core, okay, the core muscle. This is one that originally was referred to as the core, but these days anything to do with the stomach is referred to the core. But what we need to do is focus on that transversus abdominis, which tends to pull your stomach in, control everything together, and also helps to close that separation of your rectus abdominis. Okay. When we look at the transversus abdominis, we also need to look at your pelvic floor muscles. The pelvic floor muscles, hopefully you've been doing all your pelvic floor exercises post-birth and lead up to it, because this has a big indication of how quickly your stomach can get back to a nice flat tight shape post-birth. The pelvic floor and the transversus abdominis, the deep abdominals, are what's called a reflective loop. So if we activate through your pelvic floor muscles, okay, in theory what should happen is this transverse abdominis should contract at the same time, okay. This is called a reflective loop because one's doing it and the other one could carry on doing it as well. Sometimes this doesn't happen, sometimes there's some few things that get in the way neurologically, but most cases this will happen and then can be built back into your exercise and training program. So in terms of the main exercises to focus on post-birth, all the ones to do with the pelvic floor activation, to do with the integration of the deep abdominal wall, and to try and stabilize the pelvis. In terms of movement, as we get moving throughout the exercise after giving birth, we need to sort of start at one sort of specific state, which is more getting things going, controlling things, getting the functional sort of control around the pelvis and lower back first. Then we integrate that into some harder exercises as you go along. So literally, it's always getting pelvic floor activation back, closing that separation of the rectus abdominis, okay, and then adding some functional movement and some strength to it. So when you have a baby, obviously it's a lot of lifting and twisting and carrying and picking up the little one and getting out prams and all sorts of stuff, which is pretty bloody hard work. So a lot of carrying, a lot of lifting. When my daughter was born, literally it's always carrying the left arm, doing stuff on the right hand sort of thing. I can still just about lift her in the left hand, but she is 6.5, so it's a bit of a struggle. So in terms of the exercise to avoid, what you don't want to do is do any exercises which are going to produce a pushing out of the abdominal wall. So anything like crunches, sit-ups, things like that tend to activate more the external abdominals, so your rectus abdominis, and one, it's going to stop that separation from going back together, okay. Also two, all it does is tends to push your stomach out rather than actually pull it in. So the reason that we've got that transverse abdominis to stabilise, it's great in terms of functionally, it gives you some nice solid strength around your midsection, around your pelvis and lower back. Also from a aesthetic point of view, it tends to flatten your stomach, pull your stomach in. So I don't know about you, but my preference is to have a more flat stomach rather than a pushing out stomach. So that's the first initial steps in any sort of exercise program. Following on that, you need to sort of avoid any exercises which are putting too much loading through abdominals, like going back to a full plank, which is done on your feet and elbows. Something like that tends to just, you wouldn't have the strength through the transverse abdominis, and then what you tend to do is you tend to cheat and try and activate your external abdominals, your rectus abdominis, which tends to push your stomach out. One, if you do something like this, you increase the risk of hernias, because if that separation is there, the abdominal wall is not strong enough, and that's when hernias can develop. So you need to make sure that separation is closed, okay, or it's closed enough and they still have enough functional strength through there to do all those other exercises. But that's further down the line. If you do those exercises, first of all, you can mess your stomach up for sure, but it also can cause that protruding stomach, which we don't really want. We're trying to go the other way in terms of more of a flat stomach, tight stomach. But something you can do going forward, there's lots of harder exercises. But literally, if you get the foundations right first of all, then you integrate these into different movement patterns, like when you're bending into the cot, picking the baby up, that's still a forward bending pattern. Getting things into out of the car, there's a lot of rotation going, carrying things, stacking up prams, all sorts of stuff with shopping, everything. It's just, there's a lot of different things involved into it, and it's literally a lot of hard work. So if your abdominals aren't strong enough to maintain this hard work, then that's when you tend to do yourself an injury, or mess the stomach enough that it doesn't actually repair as quick as it should do. So hopefully this is giving you a bit of an idea about the abdominal sort of role of the abdominals in a postnatal exercise program. Another big thing we need to talk about is relaxin. Relaxin is a hormone. It's released to the body leading up to the last stage of pregnancy, which helps to make things a lot more flexible, so make it a lot easier through childbirth. With relaxin, it does tend to stay in your system. Some studies are saying up to about 6 months post birth, but also some studies are showing that can be extended, depends on how long you breastfeed for. The longer you breastfeed, it's still promoting relaxin, which is still promoting that increased flexibility through your body. So if you naturally are quite a flexible person, then what may happen is you have too much flexibility around joints, and that's when you can injure yourself. For example, if someone's going running, pelvis is quite unstable, okay, then with relaxin it's even more unstable, and then the abdominal separations are back together. That's asking for a lot of trouble, because the joints are not stabilizing enough in the movement. If a lunge or anything like that, and we can have the tendency to promote lots of injuries. So it's just got to be a bit careful about different things in the body, and just have that awareness of all these different hormonal factors going through, the different changes your body's gone through throughout your pregnancy, and then start with the basics, build those foundations, and then once those foundations are there, you can then progress on to harder exercises, providing you've got enough strength and control through your abdominals. Okay, so that was day 2. Day 3, what we're going to talk about is recovery, sleep patterns, circadian rhythms, all those different things which can be completely messed up right now because of lack of sleep. Certain little ones keep me awake at night, so we'll talk about some different strategies to do with this, and how we can best make the most use of different sleep times throughout the day, etc., and how we can help the body recover and heal to make it progress a lot easier with the exercise. Okay, so again, if you need any further help, I can be emailed at linden@yummytummies.co.uk, but I shall see you again tomorrow.